Hi, thanks for joining us again this week. My name is April and we have Maria here.
Hi, my name is Maria.
And today we're going to be talking about emotional and mental health. And we have a quote here that I think will definitely talk a little bit more and elaborate on the mind-body connection. So your body is an absolute mirror of your mind by Abraham Hicks. And just a review from last time. So we went over the many areas that are involved with physical health. And just as I mentioned right now, physical health and emotional mental health are very closely linked. And so we're going to be going through that today, and then we're going to be talking about SMART goals.
All right, so we're going to start. What is emotional and mental health? So what is the difference? And so emotional health is when we manage and express our emotions when they arise. And so an example would be, I feel angry when. So I feel angry when, I drop my laptop. So it's not my work laptop, but it's my personal laptop. And so, and mental health is how we process and understand our experiences. And so that's a little bit different than emotionally expressing ourselves. It's mainly how we process the information. So I felt angry when or because I dropped my laptop. So I'm processing the reasons why I'm angry.
All right, and so we're going to dive a little bit deeper into this mind-body connection. So again, as stated in the quote, when we opened up, whether we decide to verbalize our emotions or not, they tend to surface anyways. And so we have some pretty common manifestations that can kind of really clearly communicate to other people what's going on as far as like our emotional and mental health. So we'll definitely read people's facial expressions, nonverbal body language, and just maybe even just kind of like their vibes that they might even be giving off in terms of like where their mood is at.
Yeah, and to piggyback on the vibes, so it's also including, facial expressions and how our body is postured and, talking with our body. Sometimes we talk with our eyebrows or with our hands, or so that's mainly what, kind of the other types of communication that we do with other people. It is also very important to check in with our mental health. Probably, if possible, even if it's just for 5 minutes a day, because again, our mind and body connection is a lot stronger than what we give it credit to.
Mm-hmm.
Yeah. And, one thing that we're starting to notice is that in integrative health, we work for a company that does integrative health, meaning we are connected to physical health. And anytime that, people go to a clinic, health clinic, there's, they go in for obviously physical health reasons, but sometimes, again, sometimes our bodies are reacting to something that's going on mentally or emotionally. And that's where we come in. And we come in to reduce that stigma, because guess what? We all have a little bit of something going on. We all we all have, just things that anxiety and depression. And I mean, especially right now with COVID and social isolation. And so, yeah, that's mainly what we're here to do, is just to reduce the stigma and, just talk about the mind and body connection. So as frontline people to preventative medicine.
Yeah, and I think that, having, behavioral health inside of a medical clinic is what really helps to reduce the stigma, because we're all taught, I think, from a very young age that we do need to take care of our physical health. And it's not really, taught to also take care of our physical health. And so I think when we're able to kind of pair up with the medical clinics, it kind of connects that, okay, yes, my mind is just as important as my body. And, thank goodness for doctors who are kind of, promoting this mental health, because they're the ones who already have rapport with patients. So they're able to kind of say like, your mental health is really important. And, here's what I think, would be really good for you to do as far as like, maybe either getting counseling or seeing a psychiatrist. So having that relationships with the doctors is really important.
Yeah, and not only that, like, learning about, how our emotional health interferes also with our mental and body connection, that's big. When we're not able to process how our emotions are impacting us on a day to day, it can, come out in different ways. It can come out, physically, it can come out, mentally. So yeah, so just really, really being okay with that.
Mhm.
Okay to process these emotions and our thoughts and what goes on in our day.
So, what are some causes of depression? So, some causes that we see are if people have been in abusive relationships, environments. This can be physical, sexual, neglect. But when we see abuse or trauma that happens in somebody's life, that definitely takes a toll on your emotional and mental well being. And then again, just as we've stated, that will then come through in our physical expressions, our physical health.
Yeah. Another cause for depression, just like physical health, when, we go to the doctor and we fill out our histories, sometimes they ask us, is there a family history of A, B, and C? Same with mental health, sometimes there are some things that are passed down genetically. Depression could be one of them. So, yeah, just learning about family history and, just watching out for certain symptoms. That can be really, really helpful just so, we can monitor and we know what, just plan to take place if in case the depression does come in.
Yeah. And also major life changes. So a lot of times with maybe bigger things like a move or the ending of a relationship or a different job or the loss of a job, all of these things can kind of again affect the stressors in our life. It can impact our relationships. And so when these things kind of feel all out of whack, that can definitely play into our emotional and mental health. And then we can see maybe some depression manifesting from these major life changes.
Yeah. Also, with major life changes, our social relationships, with COVID, some of them shifted, and some people either got closer, or some people started trickling away from the relationships. And so sometimes with our relationships, whether they're romantic, family, friendships, acquaintances, work relationships, when there is conflict, for some, I mean, that can cause certain symptoms of depression.
Yeah, and then chronic pain and illness. So having to, feel pain on a constant basis, and never really knowing how severe it's going to be that day. And it just creating a lot of challenges to you being able to accomplish things throughout your day. That is definitely going to take a toll again on your mind. So it's important to be able to manage the physical health part of it so that it isn't, having such an impact on the mental and emotional aspect of it.
All right. And so what are some common signs? So when we talk about depression, there can be a couple of more signs out there, but just focusing on these ones, our sleep. Our sleep is impacted. And so some people tend to sleep more, some people tend to lose sleep. And that's mainly how the body is adjusting to a depression that is entering. And so just knowing yourself in your sleeping pattern and noticing if, maybe within the last few weeks, if it has been interrupted in some way, maybe checking in with yourself or mental health or physical, your PCP, your physical health provider, just to make sure things are going okay. Another thing too is sometimes when depression, starts being involved, in our bodies, substance abuse is something that is really affects the body, and that can trigger depression. Sometimes people feel the depression and then they turn to substances to cope. So it's kind of like which one came first kind of deal. And so, again, if substance abuse, drinking or any type of drugs, if that's becoming an issue, yeah, again, check in with your physical health provider, mental health provider. I mean, that's what we're there for, is to help out in a non-judgmental way.
Yeah. And then you'll also experience most likely a lack of interest in activities. So things that used to bring you pleasure and joy might not seem so exciting anymore. And maybe there just doesn't feel like this motivation to do them either. So definitely kind of, if you're noticing that you're lacking in certain areas, maybe you really used to like going out with friends, or drawing or doing crafts, or even just like a sport. And then all of a sudden that all kind of drops off. That might be a sign that you need to kind of check in with yourself, and see if there's kind of anything going on that's impacting that.
And even with that, sometimes when people start feeling a sense of depression, guilt creeps up, and just kind of the thoughts of, why am I feeling this way? I shouldn't feel this way. Even people in our lives that take notice, sometimes people don't understand, and then they're like, oh, I feel so bad because A, B, and C. So guilt comes in, and so again, if that's something that people experience during the depression, that's one of the signs also.
Yeah, definitely. And then, you can imagine, as we're kind of going through these like signs of depression in the body, that this is going to feel a little bit draining and overwhelming. And so you might notice that throughout your day, you have very low energy levels. And so, sometimes it doesn't even matter how much sleep you get, you still wake up and you're still feeling that kind of lull. So again, that's a sign that maybe you need to talk to somebody, like a doctor, and figure out why is it that my energy levels are so low.
Yeah, there can be, physical reasons for it, or sometimes it's mental. And so just going to the
Mhm.
CP first to rule it out, and to see physically if it's something they need to focus on, then that's definitely the first step. Even with low energy and like really not wanting to do things, and even if there's a disruption in sleep, sometimes it's really difficult to concentrate. So during the day, if some people tend to have this fog like, thinking during the day, just really kind of like out of it. And so that's another symptom.
Yeah. And then disturbed appetite. So that can look like not feeling hungry and really not having an appetite throughout the day. Maybe you even feel like, oh my gosh, I've gone all day and I haven't eaten. So I kind of have to put something in my body. And then, the opposite of that, like maybe you feel like insatiable, like you feel like you're constantly eating, constantly snacking. And so either extreme is definitely a sign, again, that it's time to check in with a primary care provider, because again, it can either be a sign of depression, or like we were mentioning, or some other physical health issue.
Mhm. And with depression, we know that there are people that experience suicidal thoughts, and there's some people that just have those thoughts that come in. Some people, when it's pretty severe, it's begin to plan ways to end their life, or even have more of an intent to move forward with it. But we do recommend that if there is suicidal thoughts that just come in, you know, whether they do have plans or not, please, please, please go and talk to your doctor, talk to a mental health professional, because again, that's definitely something that we're there for. And, that's part of depression for some people. And, if in case, it's hard to get connected to them right away and it is an emergency, we always suggest to call 911. There's a hurt team that they're specifically there to help with that. Or you can always call the Access and Crisis line at 888 888-724-7240. Again, it's 888-724-7240.
Yeah, and I like that you mentioned the PERT team, which is the Psychiatric Emergency Response Team. And so with them, instead of just coming out with officers who maybe are not trained in the areas of emotional and mental health, they'll actually bring out a clinician who has a background in one of those two, and can help you and bring support to you during that time if you felt like you needed time to go to the hospital. And again, they can just offer you that extra support that's more geared toward emotional and mental health.
Mhm. Yeah, and that's a really good trickle into taking care of ourselves, you know. Again, if those thoughts come in, it's definitely good to know our resources before it happens, so that way if it were to happen, we know where to turn to. And so, talk therapy, even talking to a psychiatrist if medication is something that could be helpful, that's one way to help ourselves during the times of depression. Another thing is that we know that, again, energy levels are impacted, but even just taking a very short and brisk walk outside, putting on our mask, going outside, it can probably shift our moods. We don't know. A little bit of movement, a little bit of stretching, that's waking up the body, that's giving us, different hormones that help with our mood. One of them is endorphins. And so that can be helpful for depression and taking care of ourselves during that time.
Yeah, definitely. I think, it's important not to overwhelm ourselves. And I think a little goes a long way. And you'll hopefully see the impacts of that by doing some of those small movements. And then another thing would be to get on a hygiene routine, a sleep hygiene routine. So this is kind of the way we look at it, is to kind of prepare for that really good rest, because sleep is so important to our emotional and mental health. It's the time for us to kind of turn off our brains, give them a rest, and kind of recharge for the next day. So we want to, kind of set our bodies up to have the most restful sleep that they can. And so turning off electrical devices like an hour before bed. This is maybe a preference for some, but taking warm baths right before bed can help kind of lower your body temperature. And that is necessary to kind of start to wind down. And then doing just like relaxing things. Maybe it's reading, maybe it is like listening to some soothing music, whatever it is that can get you into that mind space where you're able to kind of turn off and get ready for some rest.
Yeah. And even preparing for bed, sometimes, with the appetite being impacted too, either we eat too much or too little. Sometimes, we tend to neglect the quality in the foods that we put in. And again, physically, it will do so much better if we focus on, feeding our bodies during that time, just more nutritious foods, a lot, I know on my end, when I eat a big juicy burger, soda, fries, even though I feel great for those 5 minutes that I'm eating it, later on, it really affects my mood, and it affects the way my stomach feels, and physically in every which way. And so, just being in tune with how our bodies react to what foods we're putting in, versus if we were to put more nutritious foods, we might not have those, side effects that I just mentioned.
Yeah, and I like that you bring that up. There is even different foods that can be helpful in aiding getting you to sleep. So different like fruits, teas, things like that. So again, this is why it's so important to check in with a doctor, because they can even give you a referral for a nutritionist, or maybe they even have some suggestions for you. But that can be a part of your overall routine for wellness. Um, and then we have support people. So people who make you feel heard and supported. That's really important during this time, because it makes a difference when people kind of check in with you and they're really there for you, and you feel like you have somebody that you can kind of trust and lean on in these really difficult times. Again, I think, we kind of went over this in the beginning, but and we're going to actually dive into it a little bit more next week. But we are social beings. We need to have that connection with other people, for us to feel good. That's just one part of our lives that we do have to take care of.
Right. So we're going to move on to anxiety in the body. And so, what are some causes of anxiety? So same with depression. We sometimes it just comes in our genes. So having a little bit of family history, if you have parents, great, grandparents, aunts, uncles that might have anxiety, it's good to maybe you know check in with your doctor, or check in with a mental health professional, just to see, how your anxiety levels are. Again, because some things can be passed down.
Yeah, and same, again, any experience of abuse and trauma, it lives within inside the body. So not only are you going to maybe have memories of it, maybe even sometimes we hear about nightmares. So that can be more of the post-traumatic stress syndrome. But we do have physical reactions, based on the abuse or trauma that we might have gone through. And it very much creates that anxiety in our body. So things like shaking, we might experience like headaches, stomach aches, but you definitely see that physical manifestation of anxiety coming up with past abuse and trauma.
Mhm. Yeah, and even with past, trauma, sometimes some people tend to look for alcohol and drugs to eliminate some anxiety. And honestly, sometimes after that short amount, that it might relieve it. Sometimes it makes things worse,
Mhm.
long term, and or sometimes the anxiety causes people to drink or to use drugs, or the substances or the drugs cause the anxiety. So it's always really nice to check in with somebody that that can help you out and sort things out, to see which one came first, and to gain healthier coping skills.
Right. Yeah. And then we have phobias. So these are a little bit different in that it's a very specific thing that we are afraid of. We have like almost like a paralyzing fear about certain things. And that creates a lot of anxiety in our body. One that I can think of is like maybe agoraphobia, so the fear of going outside, right? And so anytime you're kind of tasked with having to leave the house, maybe for groceries or driving and things that are very typical throughout your day, that can be really, really terrifying. So again, we think about the stress response and how your body is reacting to having to leave the house. And that's how we create a phobia, because that feels like a very uncomfortable feeling. So we don't want to have to like feel that way when we're having to do these things. So phobias are something that can definitely come up from anxiety.
Oh yeah, and that definitely was something that many people were experiencing when COVID started. A lot of people
Mhm.
want to go out, for a fear of obviously contracting it with reason. Um,
Right.
yeah, so there's other phobias. There's so many phobias out there, but mainly just exactly what you said. It's just avoiding something, and it's just anxiety inducing, where we just don't want to deal with something that's giving us this fear. Another thing is medical conditions. So again, we don't know. So there are some things medically that can cause anxiety, and then vice versa. There's our anxiety can cause some medical conditions. So I know on my end, when I feel anxious, it goes straight to my gut. It goes to
Mhm.
my stomach. Other people experience so many different other types of symptoms in their body, which we will talk about shortly. But again, yeah, just going to your doctor and or a mental health person, and yeah, trying to see how the body and the mind connection intertwine with each other, and again, how to better deal with it.
So anxiety in the body, how can your body let you know that you might be experiencing some of these things? So again, we kind of touched on this a little bit, but like fidgeting and shaking is a big one with anxiety. It's just that, again, that stress response is pumping a lot of adrenaline in your body and it's not, not really being used. So you might start to fidget or shake within your body.
Mhm. Yeah, and another one that's really common is shortness of breath. So just having the shallow breathing that, some people tend to feel that they just can't breathe. And so that's another sign of anxiety and a sign to maybe just tell ourselves in that moment, okay, I'm going to pause and I need to breathe. And so, breathing in, for 4 seconds, holding it for 7 and breathing out for 8 seconds. And mind you, that takes a lot of practice, but, just doing these, there's so many different breathing exercises that help to reduce anxiety and just kind of give our brain the oxygen that it needs when the anxiety is present.
Right. Yeah. And then we have like different ways that our body might be responding. Like we kind of mentioned headaches, stomach aches, pains. But again, if they're not better explained by a medical condition or some physical health issue, then it might be pointing to anxiety.
Yeah. So now we're going to focus on our mind. So, how does anxiety impact our mind? Well, excess worrying. So worrying is very, very normal, but excess worrying is an all day obsessiveness with worrying about what could happen that hasn't happened yet, or even catastrophizing. So, if one thing happens, we tend to, say, oh, if I don't go into work, then we think of like the worst case scenarios. So I'm not going to have enough to pay my rent and food, and I'm going to be homeless, and then I'm not going to have anybody around me. So it's just we tend to trickle into the worst case scenario.
Yeah. And along with that, right? So then if we're like having these excessive worries, if we're catastrophizing everything, we want to avoid that. Like nobody wants to have to deal with that. So we might, kind of just avoid responsibilities. We might avoid people because of a fear of something going on in our relationships. But we want to stay in our comfort zone. So if we're not kind of pushing outside of that, and we see that we're avoiding too many things and not getting things done, maybe you'll even start to see some negative consequences of not taking on those responsibilities. It might be pointing to that could be a symptom of anxiety going on for you.
All right. So, how do we take care of ourselves when anxiety is present? So, the first thing that, in the therapy world we think of is cognitive behavioral therapy. So, that's, long for CBT. And that is a very, very, very helpful and scientific intervention or a theory that helps with a lot of different symptoms. And anxiety is one of them. And this is a type of theory that you can go and get treatment with a mental health professional, whether it's a therapist, psychiatrist, social worker, psychologist. So, even asking for this type, or if you see that, the practitioner practices cognitive behavioral therapy, this is a very, very good theory. And, on top of that, sometimes anxiety gets to a point where maybe medication could be a good idea. And so just trying to get suggestions, or even talking to a psychiatrist who is responsible for medications, psychiatric medications, just seeing if that might help, even if it's just short term until you get into a space where you might do with them, or maybe you might need them longer.
Yeah, and I'm glad you pointed that out because I think that is maybe a myth that we can kind of address right now is that I think some people have this fear that if they start taking psychiatric medication that it has to be like a lifetime thing, and it doesn't. It
Right.
can very well be a short term possibility, especially if you are again taking care of it in all of these different ways, either seeking mental health help, or just practicing some of these self-care activities. Um, so yeah, and then we have some suggestions here for you, like journaling. So sometimes just like writing out your thoughts and kind of getting it, pen to paper can actually be a big relief. And, and it can just be a kind of like a cathartic practice just to kind of write it all out, and put it away and leave it with that journal while you kind of go on about your day.
Mhm. Oh yeah, no, journaling is awesome. And you know, with journaling and anxiety, we know that we tend to again focus more on the worries and things that might happen in the future, um, or even having certain fears. And sometimes we are just so lost in all of that that we forget to maybe just kind of reconnect with our body in the present moment. And mainly what that means is just checking in with yourself and saying, okay, right now my mind is in the future, it's in the past, but let me reconnect it with my body right now. Where is my body? And just looking around your space and your environment, and really reconnecting yourself both physically and mentally. And that can really, really help. And that's, I'm kind of skipping through, but that's, a grounding technique. It's to ground ourselves here and now. But going back to maybe what I wanted to talk about at first is meditation. So meditation is part of that, is being in the present moment. There's so many different types of meditations. And if you're anything like me, I like to go on YouTube and have guided meditations. So that's putting on earbuds and, having somebody walk you through it. And there's so many different types. There's guided imagery where they have you, just imagine certain, scenarios and take you through them. There's breathing techniques. So those are really, really helpful. And again, there's some that are biofeedback, which is just kind of like certain types of tones and noises. And so, yeah, those are really, really helpful.
Yeah, and I think we've already kind of touched on a few of these too, like the physical activity. So that doesn't have to be that you're going to a gym or taking a workout class. Maybe it's just moving your body. Maybe it's just taking a quick walk, or doing some stretches. Anything to kind of get your body in motion, will have a positive effect on your mind.
Mm-hmm. Yeah, and we all also we also talked about the sleep hygiene, and so taking care of our sleep hygiene, which is what we do before we go to bed, and so at least an hour before we go to bed. Some people tend to read. We got to turn off our electrical devices, aka our phones. Taking a warm bath, drinking some decaffeinated tea. So do whatever you need to do to relax your mind and body. And lastly, we also talked about, finding somebody that is supportive in your life. So, there's so many people out in this world that, at least if we just have that one person that, can be helpful in those times where anxiety is pretty high, just having somebody to listen to you, that's very helpful. And even asking them, just, if they're able to hear you out, that's also a really good thing to practice in certain relationships.
So ask for help. This is how we take care of our mental health. So talk to your doctor, call a friend, do some research. There's a lot of information out on the internet, ways that you can help yourself. We see it all the time now, even on social media with Instagram and TikTok and Pinterest. So there's a lot of information out there to help give you some ideas of how you can, take care of yourself. But again, always consulting with a professional, is recommended. Doctor, nutritionist, mental health professional. And then again, like we said, calling on your support people, whether it's a friend or family member, whoever you feel like you can trust.
Mhm. And with that, we understand that barriers are present when we talk about mental health, and one of them is stigma. And so the more we talk about it, the more we normalize it. And so, starting to talk about it with people, starting to, obviously you're able to withhold information that you don't want to share, but also, just saying, hey, I do feel anxious right now. I need to do A, B, and C to take care of myself. We are noticing that there are more and more people coming up front with these symptoms and being okay expressing them. And the more we express them, the more we destigmatize, the more we're saying, okay, this happens and we all have this in common. So yeah.
So these are some of the barriers that we've noticed to asking for help. So sometimes people might feel like they're burdening others. Again, so this is, those times where you feel like, oh, well, everybody has their own problems. Mine aren't maybe as bad as other people, or I need to be able to take care of this myself. All of these are ways that we are talking to ourselves in very unhelpful ways, and we're preventing ourselves from really accessing that support that we need. So just trying to think about it in a different way. Yeah, everybody has their problems, so they might be able to give you some advice. They might have been in your shoes before, and so they might have some really good insights for you. You deserve to be happy and healthy. And so part of that is being able to take care of yourself and reach out, maybe if you need professional help. So yeah, again, just trying to like think about those unhelpful thoughts in a very different way.
And we touched up on this before, but with reaching out or asking for help, some people do feel a little bit of guilt. I shouldn't be feeling this way. Why am I feeling this way? And so, even some shame. Shame is feeling bad about yourself as a person. And so now that's why, with a lot of research now, we are starting to understand that, our minds and our bodies are connected, and, reaching out to the professionals, which are PCPs or mental health professionals, that that's what we're here for. And so, one way to move past that guilt is to say, there are people out there that can help me.
Yeah, and then we have judgment. And I think this feeds into, right, like some of the guilt and shame is that we perceive that people will judge us. But what I can say is that seeking professional help is supposed to be that place that's free of judgment, and where these people are really concerned about your physical and emotional mental health, and basically your overall well-being. And so if you think that they haven't already seen it, they have. And and that's what makes them a great resource, is that they aren't there to judge you. What they're there to do is help you problem solve and figure out how you can get the best care that you need.
Yeah. And so as far as access goes, we work in rural communities, and sometimes having access to doctors or professionals in the mental health world, it could be a barrier for some people living in different areas. But one good resource that we know, at least here in San Diego, is to call 211.
Mhm.
And just to, or even talk to your insurance, see if there's anybody that they can refer, or it's in your provider's list. So that way, you do have access. Another barrier that we do find is confidentiality. So that mainly means is, keeping things private, between you and your doctor, between you and your mental health worker. And guess what? Things are kept private. We don't know, mental health workers, we don't, um, talk to other people about, people's personal stuff. The only exceptions to confidentiality, because we are mandated reporters, is if a person is a danger to themselves or others, or a person knows of a child, or if a child is being abused in any way, or an elderly over 65 is being abused in any way. So, we are mandated reporters, and we want to protect the safety of these populations. And so, other than that, everything is between you and your therapist, between you and your doctor.
Right, definitely. And then I think, the next one kind of goes along with judgment, right? We're afraid to be labeled in a certain way, and that's, I think, something that we're working towards, is overcoming those labels and understanding that we all have mental health, because we're all born with a brain. And so,
Human
we
beings.
are starting to understand that there, is a need for us to take care of that and to be open about it, and to not use labels to kind of demean, the different things that people struggle with mentally and emotionally.
Mhm. Oh yeah, definitely. And so another barrier, we touched up on this. Some people might still be a little reluctant to introduce psychiatric medications. And something that people might not know is that, depending on your situation and the severity of the anxiety or depression, talking to your doctor or psychiatrist, sometimes it can be a short-term thing. Some people end up staying on medications for less than a year, and then they start working with their doctors and trickling down on medication if they choose that they want to try that. Maybe some people might need to be on them a little bit longer. We don't know, but this is why it's beneficial to talk to somebody that is, open in a judgment-free zone to talk to you about, if medications could benefit you, whether it's short-term or long-term.
Yeah, and then with resources, again, I think this goes with access. If you have a medical clinic, ask if they have a behavioral health department, see if there is somebody who you can talk to. Maybe some of the titles you might hear are therapist, counselor, case manager, care coordinator, whatever it is, but they'll figure out if they have a behavioral health department, who you need to be connected with, so that they can help you access those resources. Or if maybe your medical clinic for some reason doesn't have access to behavioral health, again, like Maria was saying, 211 for San Diego, they'll connect you with the resources that you're looking for.
So now, nitty gritty, we're going to talk about SMART goals. And so, how can we provide SMART goals for our emotional health? And so, mind you, if we think to ourselves, well, maybe I haven't been really focused on my emotional health and I want to, utilizing the SMART goal template is a pretty good step. So, if that's something that you want to do, it doesn't need to be related to a mental health diagnosis. Again, I'll take it to the original example. I get angry when, and so maybe, a good SMART goal would be to focus on anger and, what ways that you can cope with it and really process it. Other areas could be practicing more, kindness, gratitude, self-love, forgiveness. Sometimes we're a little bit too hard on ourselves, and so, with telling ourselves, it's okay to be human. It's okay to fall down, stand up, wiggle around. It's okay. That's part of the process. And so being kind to ourselves is something that's really important also.
And I think the next one is huge for people, is expressing your emotions and being able to be assertive with other people. So setting boundaries. So that is definitely something that I think people need guidance on, and it can be difficult to set boundaries, with loved ones and support people in our lives. But I think that you'll see, once you start setting those boundaries with others, how much it improves your emotional and mental health. So we can definitely, talk a little bit more about that maybe on another presentation.
Yeah, and even, being focused on our emotional health, it can also be focusing on an activity that brings us relaxation, brings us happiness, just doing a little bit of, soul searching, to find what hobbies we like, what, crafts we like to do, if it's sports, exercise, reading, being in a support group virtually or in person with 6 feet apart, or even learning something new, learning a new language or new information. I mean, it's about really taking care of our emotional health and seeing what makes us tick. And that's not to say, life happens, and balance is key. And so even if, we're talking about creating all these goals and you tell yourself, well, it's becoming too much, the key is not to create more stress. The key is to eliminate stress. And so if creating all of these goals is creating more stress, maybe that would be another SMART goal, how not to create stress during these. uh,
So next week, we'll be talking about social health.
right. So thank you again for joining us for today's talk on emotional and mental health. And so my name is Maria.
And I'm April, and you can always find us on social media. We're on Instagram and Facebook. We do daily tips, and so you can kind of see our schedule there for the week, Monday through Friday. So if you're needing any wellness or health information, you can always check us out there.